People with chronic medical conditions such as rheumatoid arthritis and other rheumatic conditions are considered high risk for contracting COVID-19. RA patients, for example, have a 2 to 4 times greater risk of developing any infection. And we don't know if rheumatology patients are more susceptible to COVID-19, but there is plenty of reason for concern, both for themselves and their family. And patients I see have been chatting online about the new normal, which for some of them may be an indefinite period of social distancing until COVID-19 subsides, and this can be stressful. So in these cases, what does it mean to normalize this experience?
The really important message for everyone, so this is for the professionals viewing this to get out to their patients and themselves too, and especially to patients and their families and their loved ones, is that the reaction to feel depressed and upended and anxious, out of control, out of sorts, is totally normal. There's a way that in the world at large, we pathologize and stigmatize mental illness and depression, anxiety. But I'm really trying to make the point, as are a lot of my colleagues in psychology, that this is a normal reaction to a really abnormal situation, an unprecedented situation.
Mm-hmm. Well, how can compromised emotional and mental health affect a patient with chronic illness? And in these patients, they probably already have anxiety and depression, which is more common in patients in the rheumatology community. So, how can it affect their mental health? Just adding stress upon stress?
It's such a great question. So the psychological surface layer is that we think about depression and anxiety being overrepresented in people who have a chronic illness and chronic disease really as a state of being. There's a lot more to manage. There are interruptions to life and vocation and family planning. But really at its most basic though, we also think about depression as an inflammatory disease. So there's probably more a common denominator there than just the kinds of psychosocial stressors that come to mind when we think about the risk for depression, anxiety with chronic disease. So depression is an inflammatory condition. So it can worsen people with immunocompromised states. It can worsen all of the related function that's so imperative for someone with a chronic disease. So self-care, it can make self-care more difficult. Medication compliance, it can make sleep more difficult. The overlap between sleep disturbance and depression is almost 100%. So it erodes all of the functional supports that someone with a chronic disease has.
Mm-hmm. And with the lack of sleep, that can affect your recovery. It can make your
That's right. That's right. There's a direct relationship between mood disturbance and compromised immune function, like period, end of story. And when you add to that mix someone whose immune function is already compromised or who has a chronic inflammatory disease, they're already without the kind of reserve that the rest of us benefit from. So they have more to lose in states of depression, anxiety, chronic worry, stress, all of the above. So sleep is imperative, self-care, all of the tools that we'll talk about in just a few minutes.
Mm-hmm. So it actually affects the recovery then. I didn't realize that there was such a connection between the two. An actual
directly.
Connection.
Directly.
Mm-hmm. So in that case, what should rheumatologists do to address the emotional and mental health needs of their patients? Do they screen? Do they screening?
Yeah, I think I'm a big proponent of everybody in their office should be screening, if not using an empirical tool, to have a conversation about someone's mental well-being at every one of those visits. So it's certainly at the top of a lot of my physician colleagues' agendas, and they're doing a great job of that. And some others are so snowed under that it doesn't come up in the course of a very quick meeting or a telehealth appointment. So everyone should be checking in on that. I'd actually found some of your viewers may have seen this. This was an article published recently, just a month ago in The Lancet, that reviewed all of the studies for mental health of persons who are quarantined. So this is like
Oh,
SARS and MERS and really interesting things. So for all of recorded research, there was just over 3,100 studies, and there were 5 common denominators to the experience of people who are isolated. So this applies so much more directly to a population of folks who are immunocompromised or have an inflammatory condition. So the first was frustration and boredom. The second was a fear of lack of supplies. The third was lack of information, lack of clear, consistent information. The fourth was for all kinds of social support reasons, not understanding the duration. So shorter duration, self-imposed quarantines, people fare better. Longer, people fare worse. And the fifth was fears about the risk for infection. So when you think about the relevance of those 5 things to this population, to our spoonies in the world, this is their experience. There's absolutely nothing a physician can do to reduce someone's worries about their risk for infection or to reduce the duration of their isolation. Where physicians can intervene, though, are on those first 3. So the frustration, boredom piece, to encourage routines and to encourage people to pick up some kind of novelty in the course of a day. So what are you going to do to break up the routine, or the monotony is going to create a kind of madness? The second piece with supplies, how can physicians be helpful with ensuring that these patients have a supply of the medication they need so they don't need to go to the pharmacy? How can we put people in touch with food bank resources and delivery resources so that their risk is minimized? There's a lot that we in the professional world could do to better support folks from a supply perspective. And that third piece on information, what if we as the professionals became the source of vetted, accurate, timely information? And that might be newsletters or proactive reaching out with updates periodically. It's really important for physicians especially to seize their role as that person now. They really want to be the messenger who relays risk and relays reduction of risk to their patients.
Mm-hmm. It's amazing. It's a lot of work for physicians. They've turned to telerheumatology.
Right.
And so this is another new tool that patients have to engage with. I imagine for some it's working well, for others I don't know if they even have the resources for that.
Right. That's right. It's a huge problem, right? Access to the kind of high-speed internet to do a video conference, or even to have a private line where you could have a conversation with your physician.
But with the tools that you've described, this should be helpful to both doctors and patients.
That's right.
I'm sure a lot of them are concerned about the future, not knowing what the future holds, how long it's going to last, if this passes for the normal healthy person. But you know, there still may be some risk for an immunocompromised patient.
That's right. And it's likely to be longer for them, right? So it's been taxing for everyone, and it's going to continue to be taxing for our spoonie patients.
Right. Let's talk about grief for a minute, because along with this comes a lot of real grief. A lot of people know someone who has died, or know of others who have family who died. So it's touching all of us directly and indirectly. So do you have any tips for physicians who might be dealing with a patient who's had a really hard time?
The most important, the construct that I want to address, just grief, the most important point to make is that a lot of people have been touched by grief with loss related to COVID-19. A lot of people have been touched by loss with funerals that they haven't been able to plan or attend. So there are non-COVID-19 related deaths that a lot of people have suffered in the window of time since late January. And there are the kinds of losses that people sustain on an ongoing basis. So financial loss, economic loss, role loss. They may have, shifts to the kinds of supports. So they have less social support. So they grieve the loss of their friendship network, for example. So grief is so pervasive. I think we should assume someone is in the throes of grief unless you hear or have some reason to know otherwise. And it's really difficult to manage grief in isolation because we societally manage grief in a social way. So we have all of these rituals around mourning, for example, that are designed to promote resilience in the face of grief. And we don't have those rituals available to us now. So it's even more important for folks to rely on the social connection in whatever form that might take. It's remote, it's Zoom friends, it's Meetup, it's Google Hangouts, it's whatever technology, it's telephone calls, it's someone leaving a note on a doorstep. There's a real need for that kind of social connection in the absence of the kinds of social rituals that would allow us to process our grief, and to assume also that we're really storing all that up for a time when we are able to more properly grieve. So in the meantime, it really is about like staying afloat, and we're really kicking the can down the road in a lot of those cases, right? Especially for the funerals of loved ones and friends.
Sure. So for now, the best they can do is to gain some control of the situation is
That's
follow
right.
the recommendations that you've outlined.
Yep.
And be in regular contact with your doctor, your rheumatologist.
That's right. Right. Imagine a world where the rheumatologist became the arbiter of news and updates, right? That could be as easy as newsletters, or like I mentioned, a more proactive system of outreach and checking in on patients, which is also very taxing, but there's a way that the role of the physician can be leveraged to promote well-being in patients in a way that is also really unprecedented.
Right. They've been doing that, a lot of proactive outreach, a lot of
That's right.
email and websites and
That's
YouTube.
right.
They're
That's
using
right.
everything at their disposal.
Yep.
Did you want to close on harnessing resilience?
Yeah, I love this. So there's so much that we do that we know is directly related to well-being. And we talk a lot about resilience as being some characteristic of people who fare better during stress. And it really defies research in a lot of ways because it's hard to narrow down, well, who will fare better in a stressful event? But they all have some things in common. So things like regular sleep. And you may have seen the headline recently looking at New York City residents who are reported, just looking at electricity usage, are sleeping longer. So they're sleeping in later in the morning and using more electricity during the day. So that could ultimately be a good thing if people who were sleep deprived before are getting enough sleep. It's also a terrible thing to sleep too much, right? So the 9+ hours when you're bored and spending more time sleeping is also a bad thing. So people who are resilient have good sleep hygiene in common. They also have regular physical activity in common. And this doesn't mean becoming suddenly a marathoner or assuming that the kinds of exercise you see on TV that really don't fit for you are required. Here, we're just talking about elevated heart rate in whatever way is adapted for your function in very brief intervals. And the third piece they have in common is the use of all of the tools that as a psychologist, we make available to patients. So this is self-talk and mindfulness and progressive muscle relaxation and meditation. And those interventions have this incredible effect on everything from psychological wellness, but also chronic pain and directly also on immune function.
So it's important to keep active then.
Yeah.
And it essentially keeps those negative thoughts at bay.
That's right.
It keeps them on the right track, right?
That's right.
Right. Okay.
Exactly.
Is there anything else you'd like to share with our viewers today?
The point that I'd make for your viewers really is that patients also like us who have chronic illnesses and chronic diseases are in some ways better prepared to weather this kind of pandemic, right? Our populations are used to isolating themselves when there's any flu bugs circulating. They're used to pivoting to have social connection with people versus in vivo or real-time connection. So in some ways, the physician's task then is to leverage the strengths that their patients already bring to the table and to just ensure they stay afloat, because they're at risk for a longer period of time. And for some folks, it may be as long as next winter.
Yeah, okay. Well, thank you. Thank you, Dr. Gorgens. I appreciate your time.
Amy, I so appreciate you. Thank you for having me.
And your advice is so valuable. So thank you.
Thanks. Thanks, Rheumatology Network.